Welcome to For Your Head Media. This is Miriam, nurse practitioner. We're going to talk today about depression. What is depression? Depression is when there's feelings of hopelessness and sometimes loss of interest. And remember, with depression, you are not a weakling at all. And sometimes it's not something you can just snap out of it, because that's what people may tell you. What are some of the signs and symptoms for depression? Feeling of hopelessness, feeling tired all the time, having problem with sleep, thoughts about death or thinking about death all the time. Some people have suicidal thoughts to where they're thinking of killing themselves. So when that happens, if you're living in the United States, you can call a hotline 1-800-273-TALK or 911. And how is depression? What are some of the things that could cause depression? A lot of times the hormones have something to do with that. Sometimes the causes are known, but sometimes there's also brain chemical changes that could cause you to have depression, some disease condition, menopausal woman, sometimes pregnancy. Those things could cause you to, some of those things could cause you to have depression. So also risk factors such as, a man that has just lost a wife, people in their 40s and 50s, and they are widowed, or you are lonely, alone all the time, all of that could cause you to get into depression. So what are some of the ways, how do we diagnose depression? A lot of times the presenting symptoms, the signs and symptoms or complaints that you are having. And also we could also do some blood work to make sure, because sometimes your thyroid level is not right, or your blood count, the vitamin level, or even things like diabetes, undiagnosed diabetes could cause you to be having some of these symptoms. So it's good to go ahead and see your provider, your doctor or nurse practitioner, so that you go ahead and check and diagnose. Remember, it's not a weakling disease. It's not something you can snap out of. So when you go and see someone after they have diagnosed, then there's medication. They give you medication to do that. Just remember that when you're taking these medications, do not just stop, without consulting your provider, because some of the medications might not be, it would not be good to just stop them like that. Also, they will also do what is known as talk therapy or counseling, and meaning you sit down and talk with someone. So just remember that depression is not a weakling disease or something to snap out of. Then the maintenance, what do you do for maintenance? Just make sure that you are seeing, taking your medication as prescribed, following up with your appointments, interacting with family members, and know when your symptoms are not improving. Okay? So make sure that you take good care of yourself. Depression is not a joke, because people take it as if, oh, you need to snap out of it. And I'm telling you, it's not something to snap out. If you're not feeling good, go ahead and get the care that you need. You have only one life. Take good care of it. Okay? Well, see you in the next video. Have a great day.